we have we're switching it up, all right? And this is a very interesting topic because I personally identify as an elder millennial, if that makes any sense. But we're going to start talking about stem cells now. So here, the next talk is going to be breakthroughs in wellness and longevity. Is stem cell therapy the key to live forever? So we have a great cast coming on stage right now. So help me welcome Linda Vester Greenberg. She's an award-winning journalist, filmmaker, dedicated philanthropist over the past 15 years, over her 15-year career as an anchor and correspondent for NBC News, MSNBC, and Fox News. She covered major foreign conflicts and federal government. Along with her, we have from Mexico, Dr. Miguel Ramirez. He's a surgeon with a thriving practice in Cancun. Representatives of, y'all can sit down. You don't have to wait for me. I'll talk a lot. Representative of Celltex, company that has pioneered technology that produces millions of genetically stable stem cells, offering potential lifelong relief. And with him, we also have Dr. Camarillo, who's a physician at the Hospital Galenia, specializing in medical emergency in that hospital, along treating physician with IV stem cell therapies and stem cells in Cancun. Welcome to Puerto Rico. Have a great talk.
Thank you very much for being with us. We figure that a lot of you have questions, and so we really want to make this a dynamic conversation. Don't wait until a Q&A section at the end. Raise your hand and we'll get a microphone to you. We just really want to have a dynamic give and take. Doctors, thank you very much for flying all the way from your paradise to our paradise. There should be a mic right there. I've done a little bit of studying on these two doctors and their company, Celltex. It's headquartered both in Houston, Texas, and in Cancun, Mexico. Over 12,000 cases performed already. So if people are saying, oh, this is still new, it's not really, not for you. You've already been doing it for a long time.
Yeah, well, good afternoon, everyone. Thank you for having us here, especially Icon, for inviting us. Well, as you said, it's not only, right now might be more than 14,000 therapies applied. So we have an experience of 14 years working with Celltex. Celltex is a Houston-based company in biotechnology, growing mesenchymal stem cells. So we have seen a lot of things over these years.
And if people are thinking, well, I can only get stem cells if I'm a really healthy person, or it's only for a sports injury if I have like a sore shoulder, it turns out it's much more than that. You even treat really sick people.
Yes, we do have a presentation ready for you guys, but it's really hard scientific facts and a lot of stuff that's gonna put you to sleep at some point. But we're gonna try and go as fast as possible and be as brief and clear as possible, so you can get a better idea of what this is. In our experience, this helps, but usually the Q&A part is where people get their doubts resolved, and you get a better picture of what you might be getting into when you receive therapy like this. And as Linda said, yes, it's not just like anti-aging or life-prolonging therapies. There is much more to it, and if you let me say so, I might as well dare and say that Celltex is the only lab, or two labs, in the world that have actually achieved this. There's no other option like this, and that's why it works so well and for so many things. So, if I may?
Sure, please.
Well, the largest commercial lab that provides autologous and allogeneic, meaning your own, and what lab people call a perfect cell for donation, let's say. That's where the therapies are based, and this is the largest manufacturer and the largest production facility for mesenchymal adipose tissue-derived stem cells, meaning they come from fatty tissue. Celltex was created, the parent company, Celltex Corporation, was created in Houston, founded in 2011, maybe as a need to resolve some questions and to actually promote stem cell therapy, something other than just the conventional medical treatments, and where those fail, well, this comes as a very good option. There's, several business models for Celltex, where one can bank your own cells and have them stored in there, maybe for use in a therapy, or just as what pretty much constitutes health insurance. You have that bank that will allow you to receive therapy even if you're in frail condition further down the road, or if you want to prevent some consequences from a significant surgery, or if one has an infection, well, you stored your cells when you were healthy, they're going to work for you. If you cannot do that, then you have the other option, the perfect cell, the allogeneic stem cell replacement, let's say. FDA, we've heard that there's a lot of hurdles and hoops that you have to jump over and through. We've already been through that. At least in Mexico, where the equivalent of the FDA is called COFEPRIS. We already done that. As of March this year, we have both protocols established, and they are authorized to be done specifically at Cancun. And based on that, the FDA has given the green light for Houston to actually start delivering therapies. Most of them. All of them are only available in Cancun, but some of them are ready to be used in Houston as well. So you do have that opportunity. International operations is referring to the Mexico-based Celltex Mexico. That's where we come from. Well, this is what we were talking about. There is patients that have no illnesses, they bank their cells and they receive therapy, but they are healthy and they just use it as anti-aging. But the truth is that all of this technology and all of this procedures were developed to help humanity, literally, fighting neurodegenerative conditions, autoimmune conditions, things that are what we could call really bad diseases like Parkinson's, Alzheimer's, dementia, chronic traumatic encephalopathy, which is a TBI, the traumatic brain injury, diabetes, heart disease. It's a lot more stuff, but those are the ones that we focused on, and those are the ones that we've proven that we can make a difference. And those are the ones that are authorized to deal with, at least in Mexico and partially through the FDA in Houston. This is a long, a nasty bit.
Yeah.
So it's a proprietary media, which is a culture where those cells actually grow. Celltex is the only one that figured out how to do it. That allows us to get maybe from a adipose tissue sample that you get maybe anywhere between 50 and 125, if you're really lucky, 125,000 cells, stem cells, mature, stable stem cells. With that media, we can grow billions, literally. And you get that fat sample, and those cells, the original ones, get reproduced over and over and over, and you can have billions or whatever number you can think of from those original cells. Then if you don't use them, then they go into cryopreservation, so you can have them for whenever you need to, if ever, knock on wood, right? The beauty about what Celltex did is there's genetic stability in those cells. This is not what happens when cells are used for therapeutic purposes, but they do it in the lab just to challenge them. They clone those cells, and they clone them for a second, third, and until they go to the 14th generation, and they match the genetic components between one and the other. If nothing changed, those are considered to be genetically stable. Those are just for research purposes. The original ones, they get tested every time, so you can get clear, genetically stable cells and not have any risks. Everybody's afraid of those. They don't differentiate, they remain as stem cells, and they don't turn into liver tissue or pancreas or muscle. They remain stem cells, so when they arrived into the war zone that is your body, they do differentiate into whatever you require, and they change into tissue that will help you. Uh, there is also the viability issue. Every time cells do leave the lab in order to be delivered into a patient, they get checked, so we know those cells must and have to be alive and working. And purity, meaning that you get only stem cells. You don't get immature stem cells or old stem cells that are not going to be as functional as the mature, stable ones. Those get quantified every time. So when you do get a therapy, you sometimes get anywhere between 200 and 300 million cells. And the consistent cell growth, that means they're not pushed. It usually takes 6 to 8 weeks to achieve those 200 to 300 million cells every time somebody requests therapy.
Doctor, can I jump in with a quick
Sure.
question? So let's just say somebody here has Crohn's disease or they have multiple sclerosis and they come to you and they want the stem cell therapy. How do you make sure that they are not going to reject or have like an allergic reaction?
I think this is actually the next one.
Yeah.
You can take it.
But basically, this is a very personalized medicine, so you have two options. One of them is having your own cells, so there's no risk because you're receiving, it's like doing an auto transfusion. So being your own genetics, your own HLA, which is your marker of your own personality, it's not gonna make any reaction in your body. But if we talk about using perfect donor cells, which are these new cells that are called allogeneic, these cells have been tested and they have been erased completely of this HLA complex, which is a marker. So as soon as they enter into your body, they're not gonna respond as a foreign body. The other thing is that Celltex has established a very well protocol, even if the percentage of reaction would be less than 0.03%. Our protocol is that we can provide the specific care just in case you have a minor reaction. We've never had any severe reaction or rejection. You could have maybe some fever or just fatigue, but nothing more than that.
And you can deliver in a number of different ways, not just IVs, but in the discs, even intranasal. Who knew? Intranasal.
Exactly.
But what other ways do you deliver the
we
stem?
have designed different protocols. Our gold standard will always be IV infusion, which means that the stem cells will go all over your bloodstream to find specific places that are needed to be repaired. That it's a process that we call homing. The cells will make a home there to start repairing. But if we need to approach specific sites like joint degeneration with doctors, specialists, and orthopedic doctor, so you can inject the stem cells directly into the joint. If it's the hip, the knee, or the shoulder, we have a specific protocol that it's intranasal, delivering the stem cells through the nose. That's the less invasive procedure with no risk and to target the cells to arrive to the central nervous system. We have, for neuropathies, we have an intrathecal injection, which means injecting the cells into the spinal fluid. We have intradiscal for patients that have degenerative disc disease, so you can inject the cells inside the disc. We have intradermal for ulcers, diabetic food, to regenerate chronic wounds, and also for aesthetics. So there are people that are requesting, I want my skin to look younger, but I don't want to use fillers. I don't want to use Botox. For alopecia, so there's different ways to administer stem cells.
I find it interesting that both of you have had your own stem cells banked. So, I mean, you must obviously believe in the product.
Absolutely.
There's
Yeah.
no better moment to actually store your cells than right now. When you're
Why is that?
healthy, when you're the youngest you'll ever be, because we're not getting any younger. So that's where you should do it. Like store your cells, and as I said, it's just a safeguard. If down the road you require any kind of treatment, those will help. A
And
big time.
receiving your own stem cells, like myself, for example, I have received them 3 times.
You have?
My own stem cells. And the first 2 were after COVID infections. And even I didn't have a severe disease, but after that, like this long COVID was severe. So I received my own stem cells just treatment like intranasal for brain fog, and you notice the change in the first 24 hours. It's very dramatic, and that is why, because the stem cells can start working in your immune system, shutting down all the inflammatory mechanism in your body. So that's why you respond really quick to this therapy.
Wow. So how did you feel after you had the?
It's more like clear of mind. You start feeling less pain, like joint pain. It's like a general wellness feeling that it's immediate, and it prolongs over the years.
I can fill the time with a ton of questions, but I want to encourage everybody to ask your questions too. So I'm curious, some of the cases, since you've done thousands now, some of the aha moments where you go, wow, that amazes me, where you've seen patients respond in remarkable ways.
Yeah. I think our most dramatic case is it was a 20-year-old girl diagnosed with juvenile rheumatoid arthritis. She was diagnosed when she was 2 years old. She spent most of her life in the hospital, multiple diseases, infections, allergies. When we met her, she was wheelchair bound.
Is that her?
That's her. With a gastro tube for feeding. Her life expectancy was not longer than 1 year. She was taking about 25 medications per day. So it's a very rough life. After the first treatment, she ate pizza. And she kept coming for therapies. The first year was very aggressive therapy. She received 3 rounds of stem cells. But this was 2015 or so. Now she's a mother of 3 kids, and she's seronegative for rheumatoid arthritis.
Completely.
Completely. Yes.
So is almost all the autoimmunity out of her system?
Yes. That's huge. And we could talk about dramatic cases like patients with MS that are prostrated in bed, and after a couple of treatments are able to sit straight and bring their children on their lap. That's a huge change. For some of us might be like, oh, what, it's to carry on your children.
Right.
But for them, it's life-changing. Patients that skip hip replacement that are in their 90s, so they're trying to avoid surgery and they get stem cell therapy, they're walking without any cane or walker or anything.
What's the oldest patient you've ever had?
She just turned 100 years.
Oh my gosh.
Yeah.
Really? What did she come in for?
She's a retired nurse. She just come for wellness. She doesn't have any specific condition. She just wants to keep doing her life with family.
Wow.
So
What is the sickest patient you remember having?
COPD patient, which is
COPD.
not one of those conditions listed there, but in Mexico, when somebody requests any type of therapy, you cannot abandon the patient or deny care. So you go through an initial consultation where labs are taken and you get a physical, and then you get our assessment. And we usually tell the patient, like, you have COPD, we don't have any experience in that. There's almost no benefit that we know of with the cells for you. Knowing that it could, but we cannot say outright that it should, Anyway, he was driven to the hospital that you saw in a couple pictures before, wheelchaired into the hospital with an oxygen tank because he couldn't breathe on his own. He couldn't even talk. A couple words and he was winded and he had to take a shot of air. He got maybe 2 therapies, like say a Wednesday and a Friday. By the time we saw him the week after, he came back and he had no oxygen anymore, and he was smoking again.
What?
But he lived a good 3 years. This we're talking about a picture, a Texan cowboy guy, huge, that had oil businesses. So he had tried all over the world to get some relief, and he couldn't. But with this, he recovered. That's the weirdest thing I can think of.
Wow.
Yeah, we also seen a lot of, there's a group of young girls affected by a disease that is called dysautonomia.
Sure.
Which means that they cannot regulate blood pressure, heart rate. So these girls are prostrated in bed most of the time. They have severe migraines. They're in constant pain. They faint all the time. And these girls respond absolutely great to their own stem cells. So we have most of these girls from, again, bed-bounded to now going to college, starting to work, we saw a patient last week that she said, now I'm going to live in New York, I'm starting to work, I'm hiking. So that's huge. It's incredible.
I want to remember to ask you about sort of, do you need tune-ups? But first, I just want to ask you the process. Let's say I'll just say dysautonomia, and I want to come in and have the adipose tissue, the fat tissue taken from my belly. Can you walk me through the whole process?
Absolutely. It's a very easy process. Usually you have a consultation with one of our specialists. You need to get some blood work, specifically because the lab has some conditions to receive your cells, basically for infectious diseases. This is a safety measure requested by the FDA. But the extraction, it's a very small liposuction. It's tiny liposuction that we usually do in the abdomen. So we only take like 20 milliliters of your fat. It's in and out procedure that takes no more than 35 minutes. It's local anesthesia. We just make a small pouch in your abdomen. So we take this fat, and this fat is sent to the lab in Houston. So from there, they start isolating the cells and growing their cells. So after you had your fat extracted, you would have a treatment to be infused in about 6 weeks.
So the patient would go home.
Absolutely.
Like you'd harvest it, I'd fly home, and then 6 weeks later, or you'd call me and say, it's ready.
It's ready.
And we come back, and then what happens?
Depending on, we do something that it's therapeutic recommendation, which means how many cells and the ways we are going to administer those cells. Based on that, we calculate how, or the lab makes a counting of the cells. Probably you would say you might need 600 million stem cells divided in 3 treatments. So then you come to the hospital and we administer those therapies. Again, it's an in and out procedure. You don't need to stay at the hospital because it's very safe. One of the things that we're very proud of is working in Mexico with Hospital Galenia in Cancun. This is a hospital that has Joint Commission certification, which means it's a safety and quality of attention. Also has Canada agreement and our local, which is from the Health Council. So everything is done in the hospital because even if it's a very gentle procedure, we take all the safety measure. Our medical director, Dr. Salazar, which by the way, I apologize for not being able to be here. He's emergency room physician. He's an expert in transplant. He's a geriatrics expert. So when you receive your therapy, you're surrounded by at least 4 doctors and a team of nurses that will take care of you as soon as you arrive to the hospital to the time you're being discharged. So it's a very easy procedure. You don't need to stay at the hospital. We've never had the thing to keep a patient because of any situation.
So if I received an IV, I would be back at my hotel room in a day? And
3 hours, and you can go back to your hotel and enjoy the rest of the day. Some patients might notice there's some fatigue or sleepiness, but you can do normal life after stem cell treatment. Even with allogenic cells, which are the perfect donors, we have patients that come into our office, receive the therapy, and they go back to work at their office. So it's a 3-hour procedure.
really?
Yeah.
Wow. What is the youngest patient you've ever had?
I say Tuckerbo. Tuckerbo was a child that when we met him was 9 years old.
Bo?
No, tenemos más chiquitos, ¿verdad? We have younger 6-year-old kids with PCI.
What's PCI?
Cerebral palsy.
Oh, yeah.
Yeah, we had kids with autism and they're 8 years old. Tuckerbo was also with juvenile rheumatoid arthritis. He was 8 years old when we met him.
Wow.
So
just about autism, because it seems to be more and more prevalent. What sort of responses are you seeing when you treat people with autism?
It is a great response. What we usually recommend is as soon as you get stem cell therapy, you have to increase your physical therapy, your mental therapy.
Your
so
OT, your occupational therapy?
Exactly. So these patients, from being totally absent from their surroundings or nonverbal, we have patients that now are able to communicate through iPads. So they answer very concrete questions like, do you want to eat something? Yes, no. Some of them, at least a patient that I remember, he's now able to do math through his iPad. So he's 12 years old, and he's going to regular school. He was nonverbal and very aggressive when we met him.
Wow. He was nonverbal
And aggressive.
and now he's mainstreamed at a regular school.
Yes.
And over what period of time was that?
He has received at least 6 therapies in the course of 3 years.
Wow.
So it's a dramatic change, because now his parents are able to be a little bit more relaxed. They count on that he will have not a normal life, but he's more independent now.
I'm just wondering if there's anyone in the audience who's sitting here thinking, okay, there's got to be a catch. There's got to be, right? There's no such thing as a perfect medical procedure without a catch. Is there a risk?
This is an incredible, exceptional treatment. It's not a promise. It's already happening and has been for several years, but it's not the silver bullet. We never advise patients to abandon their baseline therapies, let's say. If you're diabetic, you shouldn't stop your insulin because you're getting any of this. It's going to take time. It's going to work for you, but you shouldn't trade everything for this. This is more of a parallel kind of treatment. As the doctor said, the patient with autism, it's not just give him that and go home. It's like you have to actually double up on therapies, on occupational therapy, and on language therapy, because that's when you should take advantage. It's like if you're training for a marathon and you get this kind of thing, you should actually double up on your training, because it's going to work for you then and there, not just do that and show up for the marathon alone. It's something that will definitely, in medicine, we only do an intervention, meaning give a medication, do a surgery, whatever it is, but intervene in the condition if what you're going to do is going to make a change. If you're going to have a deviation from the natural history, meaning any condition might lead you to death, if you're going to avoid that by doing this or that, that's when you actually act upon it. And this is something that definitely changes the natural history of a condition and reverts some of the things that when you go into, like in my case, orthopedic surgery, any book you can pick up, it'll say that when the joint is gone, it's gone and you're never going to see it back. Well, that was my belief until I started seeing this, not just because I believe in it. There's no belief in medicine. You actually go and take an MRI and measure the thickness of the cartilage before you do this, and then you do the stem cell therapy, and then you get another MRI 6 months after, and then it grew double or triple its size. It's like, it's not that I'm seeing things, it's maybe the MRI is broken, but it's not the case when it's more than one patient. So there are significant things that we're barely understanding from 10 years ago up till now.
Does anyone want to ask a question? There's no such thing as dumb questions. So I'm going to keep going unless I see a hand. Why isn't this done? I mean, this seems remarkable. Oh, do you want to talk about that?
That's the horror cinema.
Well, we want to present these 2 cases so you can see the improvement with 2 kinds of therapy, which the first one is a patient that received stem cells of his own. It means autologous stems. It's a patient that had an amputation, and after 5 years of getting all kinds of treatments with hyperbaric chamber, negative pressure, antibiotics, grafts, he never responded. So he had a chronic wound that wouldn't let him use his prosthesis. It was very painful for that. So we gave him his own cells, it's just one treatment, injecting the stem cells right into the ulcer, and 9 weeks was completely closed. On the other side, we have the case of another, it's a Canadian patient that had diabetic foot. It's a chronic wound. But in this patient, we administer allogenic cells, which means from a perfect donor, because his diabetic condition was very unstable. So he received, again, a treatment injecting the stem cells right into the wound, and 6 weeks after was completely healed. So you can see that either if you receive your own or you receive allogenic cells, you will get results.
Some people may have seen on social media ads or things for stem cell procedures. Are all of them out there as reputable as Celltex, or are there scams? And how do you know the difference?
As I said, Celltex managed to achieve this by means of scientific endeavor, and we've seen it all, because we do have patients that run off of some other therapies and end up with us, and sometimes, sad to say, but most of the time they're being scammed. Sometimes they're injected with medications and not stem cells. Sometimes they're just injected water. Most of the therapies out there, anywhere you can look on, and even throughout the whole of the US, it's none of this. It's a process where they take actually some blood from you or some adipose tissue. They mash it up, and of course the cells are going to be there, but as I said, if you're lucky, maybe 25 to 50,000 cells in one of those samples. And then those might be useful for small injuries, like an ulcer that is not healing, or a bone that is not healing up, a non-union. But apart from that, it won't do anything for a systemic condition like rheumatoid arthritis or dysautonomias or Parkinson or Alzheimer's, something like that. It's not enough. So after the years and experimenting on the initial patients, most of them you saw on those slides, we've come to the conclusion that there's a threshold, which it's usually that 200 million borderline treatment. If we deliver anything below that number, there's no clinical impact. After that 200 million cells, then we do notice differences depending on what the condition is for the patient. Sometimes might be just a perfectly healthy person, but only has an injury on a knee. Well, we do need to deliver something systemic and something in the knee. And this is where it gets a little bit technical. These cells have something called a homing property. We can put them in your big toe, and 2 weeks from today, we'll find them, if we were able to trace them, in your heart and lung and liver and wherever your body chemically signals for help. Those cells will go and help that part. The only situation where we cannot give any sort of therapy is when somebody has an active cancer. If you have an active cancer, these cells will go and make a super cancer out of that, because they'll build blood vessels and give them better nutrition. So it would be crazy to do that. So that's the only, and that's part of the testing that we have to undergo in order to be able to produce and deliver cells to somebody. If you want to picture it this way, and those are not my words, this is something that more than one patient has said to me, this is the closest thing to the fountain of youth, if there is such a thing.
For real?
For real.
So if I were to get aesthetic procedures, I'd look like you?
Like, say your husband goes to therapy, after 2 or 3 therapies, you will start complaining that he looks younger than you were, even though it's the opposite.
Yeah, we noticed that some patients that had like minor conditions like just inflammation or had a joint pain, and they received stem cells, so they felt good after the first treatment, and then they wanted to come back for another treatment. Why would you come back if you already have healed your knee? I say, I felt so good that I think it might recover some of my youth. I notice my hair is growing, my skin looks better, but I feel better. So we're talking about really anti-aging medicine, which is making your body recover from external things like oxidation, stress, pollution. So these cells will repair in your body, even for prevention. Let's say you have a strong family history of Parkinson, Alzheimer's, or diabetes. So these cells will help you to prevent for showing of these conditions. So it's really talking about regenerative medicine and anti-aging medicine, not only for therapy for severe conditions.
When I think about some of the medications, some of the treatments for diseases like, MS, Parkinson's, and they're corrosive, they're hard on the body. Why isn't, but, when you're talking about the stem cell treatment, it seems relatively benign, like it's relatively tolerable compared to some of the harsh medications that people are getting for chronic conditions.
As I said, this is something that works with you, not against the disease itself, but works with your body. There is usually the wrong idea that we doctors actually do something for patients. It's not like that. Even medication. When one has a condition, say somebody is in a really delicate situation and is hospitalized in the ICU. What we do as doctors is just give him a little push here and there to keep him alive until his body actually recovers. There is nothing we can do actually to get somebody out of there. There are very few interventions that we do to save somebody's life. Like if somebody's bleeding out, well, you clamp that and he's not gonna bleed out, then you helped. It's not just his body given time, but then you have to patch it up and then it'll heal on its own. You don't actually do anything. I myself have put nails and rods and plates all over people's bodies, and that's just to hold it in place, and we still have to wait for the bone to heal. So in the end, that's what the body does. It heals itself. We just give it a little hand. These cells kind of do the same thing, but in brutal numbers. Like when one is young, you can go to parties and you can drink as much as you want, and you can not sleep, and then the day after you go to school and you're like nothing, or you go to work and you feel like nothing. If I try and do that today, it's gonna take me a good 2 or 3 days to catch up. I'm not gonna end up spending the whole night. This is something that's aging, and there's no two ways about it. When you get therapy like this, a lot of things change. These are not things that we focus on because those were not the parameters for our goals and studies, and we, even though we don't care for it too much, we do notice it because it's, unfortunately or fortunately, has to be logged on medical records. Patients do recover their eyesight and have to downgrade their eyewear. Patients recover from erectile dysfunction, although they never came for those type of therapies. They came because they had something else, but they were 70 and they suffered from erectile dysfunction while there. Prostate works better. A lot of things that we never meant to improve do improve. That's where we still have, and we acknowledge that there's a long way to go. And there's a lot of things that we need to figure out in order to advance this more and more. And as I said, if you give yourself a chance, you're going to find out more than whatever we can tell you right now.
I want to be mindful of the time. We have seconds left, so if anybody has a question, we'll squeeze it in, or else the doctors have graciously agreed to stay and we can chat out in the hallway afterward.
I have a question. What is the cost of such treatment, and is it covered by insurance?
At the moment, it's not covered by insurance because we're still in the process with the FDA to get all the, as you know, in medicine, a drug is something that has to be proved to be authorized. So stem cells are on the way to be proved to be managed as a drug. So it's still called experimental medicine. The cost is very different because of, it depends on the patient. As I mentioned earlier, it's very personalized medicine. So it's not the same cost for a patient that only needs a knee injection that a patient that has MS that will require multiple therapies. So it's really hard to say. We have a very good team in Houston that it's client services that I would gladly share their contact. We're clinicians, so we're just trying to bring the message of what kind of benefits it would be to get stem cell therapy.
Just based on the results you're seeing, sorry, and I swear this is the last thing. Do you wish that this was available to more people?
Definitely.
Absolutely. I think now with these allogenic cells, it's more available. The cost would be definitely less and accessible. We know that many patients would not like or would not want to bank their cells, or because they just need a treatment or because of economics. So allogenic cells are more affordable. Even if you go to Mexico, we have some different conditions because of all the regulations with COFEPRIS, which is our FDA. So it's more affordable. Now we can provide this therapy to more people.
Doctors?
If this was ever covered by insurance, it would be the downfall of Celltex because we couldn't deal with the entire world. That's how bad it is. And we have patients from Brazil, Colombia, Panama, the US, Canada, Australia, New Zealand, Russia, everywhere. And we can barely keep up. If this was ever covered by insurance, I don't know what we could do.
It's a good
Quick
problem.
question over here. Over here. Over here.
Can't see you.
It doesn't matter. I'm over here. Doesn't
Oh,
matter.
okay, go ahead.
The collection of cells are finite number of cells, right? They don't replicate, or is there no process to replicate them once you collect them before cryo?
Absolutely. That's the main thing, or the main goal for Celltex is that when you get a fat extraction, this sample will have only 2,000 cells. So that's a very low number. The goal is that the lab is going to multiply those cells to millions, hundreds of millions. So you have enough for 1, 2, or 3 therapies. So most part of those cells will be banked in cryo tanks. And every time you need a treatment, you take part of those cells, you multiply again for a treatment, and from that new culture, you store again more cells. So you will always have a storage of cells. But these cells are multiply, and as Dr. Ramirez said earlier, these cells has been tested and grow for over more than 14 generations, and they're genetically stable. So they are the same cells as the first generation.
That was going to be my next question. If you lost therapeutic activity as you replicated.
Not at all, because these are new cells. It's like baby cells growing all the time. So they will always be potent. Now Celltex has a test that measures potency of the cells. Even if you had your fat extraction and your banking 10 years ago or 15 years ago, you can test your cells now, and they will be the same in potency. Some patients would have less potency, but because of their own condition or genetics. Let's say patients with ALS, their cells are really sick, so they are not enough potent. So in those cases, we would suggest using allogenic cells. But over the years, your cells will not lose potency. If they're stored in nitrogen, they're freeze, they are stopped in time. So it's...
And another really quick question. Can't use the cells of someone else to treat another person, can you?
You could use your own cells to treat someone like a close relative. You would need to be tested like you are tested for an organ donation, for HLA complex, which is your personal marker. Let's say you have your bank and you want to receive your son's cells, or the other side, you have your cells, you want to give them to your son. You would need to get those tests. Are kind of expensive, but you could do it. That's why Celltex developed this line of perfect cells, so you could use donor cells. This donor is a very young patient. It's a single donor that was tested and selected from 1,000 persons. It's a female donor. And I say female because, as you know, women have 2 X chromosomes. And we can donate. There's a part of the cell that's called the mitochondria that makes the energy in your cells. So the only cells that can donate their mitochondria are the ones from a woman. So these cells are perfect cells. So if you don't want to use, or you cannot use your cells, you can receive from donor. If you want to donate your cells to your relative, if you test, you match just like a kidney or a heart, you can use the cells.
All right, we're out of time for the panel, but thank you both very, very much. Fascinating.
Thank you so much.
Thank you all.
Yeah.